Anxiety and depression are up in the age of COVID. A Lancet survey estimates the number of people worldwide suffering from a major depressive disorder rose by 28% in 2020. Those with anxiety disorders worldwide increased by 26%. The effects of lockdowns, school and business closures, and the spread of the virus in general are among the factors blamed for the rise, say researchers.
So that was a good thing, wasn't it?
Margaret Sullivan, who is 87, has been stuck at home caring for her 92-year-old husband.
There are days when I'm really sad, but I don't know whether it's the COVID that makes me sad or the other things going on that were going on anyway. For us, when you know you don't have that many years left, it's a lost year.
The elderly can be especially at risk for both isolation and faring poorly if they catch the virus. But mental health experts say they are hearing from young people the most. During the first year of the COVID-19 pandemic, an estimated 1 in 4 youths globally experienced clinically elevated depression symptoms, while 1 in 5 young people experienced higher anxiety, according to JAMA Pediatrics. Dr. Beth Salcedo heads the Ross Center for Anxiety and Depression in Washington, D.C.
I think in this country, certainly stigma has really changed in the last 20 years, and certainly with our younger population, they're talking about anxiety and depression a lot, whereas people, in my generation and older didn't talk about it so much.
22-year-old Eva Zarpas had her college studies go virtual during COVID-19. She says the isolation has heightened the anxiety and depression she already felt.
Being unable to connect with large groups of people in the way that, humans are used to. It was really hard just to wake up, being asleep was my favorite thing about the day because I didn't have to be awake and be thinking and wanting to be with people but not being able to.
Her 14-year-old sister Stella suffered too.
It's important for kids to always be around each other, just that sheer isolation, which really made it difficult to kind of cope with all the other things when you're not getting just basic needs met by talking to other people.
Experts say it will take time for the mental health effects of COVID-19 to pass.
People have lost a lot in this last year and a half. It'll be 2 years, and they're going to have to put their lives back together. And I think it's going to take a while. And I think the ramifications from an emotional point of view are going to take a long time to fully recover.
Demand for treatment for anxiety disorders has increased since the start of the pandemic, according to the American Psychological Association. Laurel Bowman, VOA News, Washington.